Hello everyone. Uh, have you ever wondered how dentists accurately transfer the position of patient's upper jaw to the articulator? The answer lies in a crucial prosthodontic procedure called the Facebow transfer. In today's session, we will discuss what a Facebow is, its part, types, principles, procedures, advantages, and clinical significance. This topic is extremely important for dental students, interns, postgraduates, aspirants, and particularly dentists. Uh, Now, what is a Facebow? A Facebow is an instrument used to record the spatial relationship of the maxillary arch to certain anatomic reference points and transfer this relationship to an articulator. In simple words, it helps position the maxillary cast on the articulator in the same relationship that the maxilla has to the patient's temporomandibular joint. Uh, Now, why is it important? Uh, Imagine mounting a maxillary cast arbitrarily on the articulator. The prosthesis may not accurately reproduce mandibular movements, resulting in occlusal discrepancies, premature contacts, and increased site adjustment, patient's discomfort. So, the Facebook transfer helps avoid these problems by accurately orienting the maxillary cast. There are certain principles of Facebook transfer. The Facebook records the relationship of maxillary teeth, hinge axis of the mandible, and cranial reference planes, and this information is then transferred to the articulator. As a result, the mandibular movements simulated on the articulator closely resemble those occurring in the patient. Components of a Facebook U-shaped frame, the main metallic frame extending from one side of the face to the other side. Uh, what is its function? It supports all the components and connects the bite fork to the articulator. Then comes the bite fork, a fork-shaped metal component. It functions to carry the impression compound or bite registration material and record the position of the maxillary teeth. The patient bites generally gently into the recording material. And then we have the condylar rods or earpieces located on both the sides of the face fork. Its function is that it approximates the hinge axis and positions the face fork relative to the temporomandibular joint. And third point, references provide a third point of orientation. Example, orbital nasion and orbital pointer, infraorbital point. These establishes a three-dimensional reference plane. Mm. Now there are different types of phase pose. The first one is the arbitrary phase pose, most commonly used in clinical practice. The characteristics of arbitrary phase pose are that it uses external landmarks, approximates hinge axis location, and is easy and quick to use. Accuracy is usually sufficient for routine prosthodontic procedures. The other type of Facebook is the kinematic Facebook. It is more accurate, and characteristics of this kind of Facebook are that it identifies the true hinge axis. It requires specialized equipment, and it is more time consuming, often used for complex restorative cases and research purposes. Indication of transfer, that is, when is it required to uh, do a Facebook transfer. The Facebook transfer is commonly used for complete denture fabrication, fixed partial dentures, full mouth rehabilitation, occlusal reconstruction, implant supported prosthesis, complex restorative procedures. The stepwise clinical procedures. Now, the step one is preparation of the bite fork. Generally, we apply impression compound or bite registration material onto the bite fork, and the material covers should cover the fork evenly. Second is positioning the bite fork. The bite fork is inserted into the patient's mouth, and the patient is asked to bite gently. And then uh, we have to ensure stable seating and proper orientation and no distortion of the recording material. Allow the material to set, then attach the Facebook. Uh, is the third step. How it is done: connect the bite fork to the Facebook frame, tighten or uh, locking screws, uh, tighten all locking screws securely, and then the Facebook should be attached to the maxillary arch through the bite fork. Now, third is positioning the earpieces. Place the earpieces into the external auditory meatus and they serve as an approximate hinge axis reference point. Confirm the patient's comfort and stability. Uh, Fifth step is to establish the third point reference. Position the orbital pointer or nasion uh, or relator, and these creates the third point necessary for proper orientation. Then check all the reference points are aligned accurately. Now, once this has been done, the sixth step is to lock the Facebook. After verification, all the screws are tightened and it is ensured that no movement is occurring. Confirm the stability of the assembly and then the maxillary position has now been recorded. Seventh step is to remove the Facebook. Carefully remove the Facebook and the bite fork while maintaining the relationship between them. Avoid disturbing the records. Then transfer to the articulator. Now the recorded relationship is transferred to the articulator. First is attach the Facebook assembly to the articulator. Secure the bite fork. Position the maxillary cast against the bite fork and mount the maxillary cast using mounting plaster. Then maxillary cast is now oriented similar to the patient's maxilla. Advantage of Facebook transfer is that it improves the accuracy, most closely reproduces patient's anatomy. Then there is it minimizes premature contacts, and there is less chairside grinding and correction. It improves prosthesis performances, provides more accurate mandibular movement. Uh, Now, some common errors that are encountered during Facebook transfer are the improper bite fork position, which can lead to incorrect cast orientation. Loose Facebook components may distort the records, and incorrect third point references produce inaccurate mounting procedures. Then, movement during the recording leads to transfer errors. And the questions generally asked in this regard are: what is a Facebook? It is an instrument used to transfer the spatial relationship of the maxillary arch to an articulator. What is the purpose of transfer? To accurately orient the maxillary cast to the articulator. Uh, which arch is transferred using a Facebook? We all know maxillary arch. And what are the two major types of Facebook? The arbitrary Facebook and the kinematic Facebook. Which type is commonly used in routine practices? Arbitrary Facebook. And what is the most common posterior reference point? The external auditory meatus. Clinical significance: without a Facebook transfer, the maxillary cast is mounted arbitrarily, and this may result in occlusal discrepancies, increased adjustment time, reduced prosthesis accuracy. Facebook transfer helps aggregate restorations that function more naturally and comfortably for the patient. Uh, a Facebook record the relationship of the maxillary arch to the temporomandibular joint and cranial reference point. It consists of a frame, a bite fork, condylar rods, and third position point references. And the phase for transfer improves the articulator accuracy, reduces occlusal errors, and enhances the quality of prosthodontic treatment. Understanding this procedure is essential for every dental student and prosthodontist.